In early 2025, New York Presbyterian, one of the nation's top hospital systems, a name synonymous with cutting-edge medicine and compassionate care, found itself at a crossroads. The institution, a pillar of the New York community and a beacon of hope for patients from around the globe, was about to make a decision that would send ripples throughout the healthcare landscape: announce the elimination of 1,000 jobs. This announcement wasn't made lightly. It followed weeks of closed-door meetings, intense financial analysis, and agonizing deliberations among the hospital's top executives. The decision, though difficult, was deemed necessary to ensure the long-term viability of the institution. Across its network, impacting various departments and locations, the sheer scale of the job cuts underscored the severity of the challenges facing the hospital system. From bustling urban centers to quiet suburban communities, the impact of the layoffs was felt far and wide. This wasn't just another round of layoffs. It wasn't a simple cost-cutting measure or a routine adjustment to the budget. It was a wake-up call for the entire healthcare industry, a stark reminder that even the most prestigious institutions are not immune to the pressures of a rapidly changing economic and regulatory environment. The news sent shockwaves through the medical community, leaving many to question the future of healthcare employment. For years, healthcare jobs seemed untouchable, a safe haven in an increasingly uncertain job market. Immune to economic downturns, shielded from the forces of globalization and automation that have disrupted so many other sectors. The pandemic only reinforced that belief, as healthcare workers were hailed as heroes and hospitals scrambled to meet the surge in demand for medical services. The demand for healthcare professionals seemed insatiable, and job security appeared to be guaranteed. But this move shattered the illusion of stability, revealing the vulnerabilities that lie beneath the surface of even the most robust healthcare systems, sending shockwaves through hospitals nationwide, prompting administrators to reevaluate their budgets, staffing models, and long-term strategic plans. The news served as a cautionary tale, highlighting the need for greater financial prudence and adaptability in the face of unprecedented challenges. The cuts weren't limited to one department. They weren't isolated to a single area of the hospital. They spanned the entire organization, impacting everything from administrative staff to clinical specialists, affecting both clinical and non-clinical roles, leaving no area of the hospital untouched. Doctors, nurses, technicians, and support staff all felt the impact of the layoffs. Hospital leaders called it a step toward efficiency, a necessary measure to streamline operations and improve the hospital's financial performance. But for those affected, it was a harsh new reality, a devastating blow to their careers and their families. The human cost of these decisions was undeniable. The layoffs at New York Presbyterian are part of a growing trend, a worrying sign that the healthcare industry is undergoing a period of significant upheaval. Hospitals across the country are making similar cuts, grappling with rising costs, declining reimbursements, and the increasing demands of an aging population. What makes this case so significant, what elevates it beyond a mere statistic in the ongoing healthcare debate, is its scale and visibility. The fact that it happened at one of the nation's most respected and influential medical institutions. If it can happen here, it can happen anywhere. That's the unsettling truth that many healthcare professionals are now forced to confront. The era of constant growth in healthcare jobs is over, replaced by a new era of uncertainty and restructuring. Now it's about austerity, about finding ways to do more with less, about squeezing every last drop of efficiency out of existing resources. Restructuring, about reevaluating traditional models of care and embracing new technologies and approaches. And tough choices, about making difficult decisions that will inevitably impact patients, employees, and the communities they serve. The public was left asking, how could this happen? How could a hospital so busy and well-resourced, a place that seems to be constantly overflowing with patients and cutting-edge technology, need to cut so many jobs? What went wrong? The answer lies in a complex mix of factors, a confluence of forces that are reshaping the healthcare landscape. Post-pandemic financial strain, as hospitals grapple with the lingering effects of the COVID-19 crisis, including increased costs and reduced revenue. Changing policies, as government regulations and insurance reimbursement models continue to evolve, creating new challenges for healthcare providers. And rapid technological change, as new technologies like artificial intelligence and robotics transform the way healthcare is delivered, potentially displacing human workers in certain roles. This is more than a headline. It's not just another news story to be quickly forgotten. It's the start of a new chapter in American healthcare, a turning point that will have profound implications for the future of the industry, one that affects everyone who works in or relies on the system, from doctors and nurses to patients and their families. The future of healthcare is uncertain, but one thing is clear: the old ways of doing things are no longer sustainable. Hospital layoffs aren't caused by a single factor. It's not as simple as blaming one event or decision. The reasons are complex and intertwined, reflecting a confluence of challenges facing the healthcare industry today. They're the result of years of mounting financial pressure. These pressures have been building gradually, creating a situation where hospitals are increasingly vulnerable to economic shocks and shifts in the healthcare landscape. We're talking about a long-term trend, not just a temporary blip. The pandemic forced hospitals to cancel profitable elective surgeries, procedures that generate significant revenue, and help to offset the costs of other services. This created huge revenue gaps. These gaps weren't easily filled, leaving hospitals struggling to maintain their financial stability. The impact was felt across the board, from large urban medical centers to smaller rural hospitals. At the same time, labor costs soared, placing even greater strain on hospital budgets. This was because hospitals paid premium rates for temporary staff like travel nurses and essential supplies, including personal protective equipment, PPE. The demand for these resources skyrocketed, driving up prices and adding to the financial burden. Government funding is shrinking, adding another layer of complexity to the financial challenges. This is happening with reduced Medicaid reimbursements and the end of federal relief programs that were put in place during the height of the pandemic. These programs provided crucial financial support, and their expiration has left hospitals facing a significant funding shortfall. Hospitals are now exposed to rising costs and less support, a dangerous combination that threatens their ability to provide quality care. This is revealing just how fragile their finances have become. The financial statements paint a clear picture of the struggles hospitals are facing, with many operating on razor-thin margins or even at a loss. Patient care is shifting too, further impacting hospital revenue streams. More procedures are done in outpatient centers, reducing hospital admissions and revenue. Patients are increasingly opting for these convenient and often less expensive alternatives, leading to a decline in inpatient volume. Inflation has driven up the cost of everything from medicine to utilities, making it even more challenging for hospitals to manage their expenses. All this is happening while labor remains expensive and hard to find, exacerbating the staffing shortages that many hospitals are already experiencing. Unlike other businesses, hospitals can't easily raise prices. They don't have the same flexibility to adjust their rates in response to rising costs. Insurance companies and government rates set the limits, dictating how much hospitals can charge for their services. This lack of pricing power puts them at a significant disadvantage. All these pressures squeeze hospital margins, leaving them with little room to maneuver. This is forcing executives to cut costs wherever possible, often starting with jobs, which is a painful but sometimes necessary step to ensure the long-term survival of the institution. The result is a relentless search for savings, a constant effort to find ways to reduce expenses and improve efficiency. Ultimately, the workforce bears the brunt of these cuts, with layoffs and job losses becoming an unfortunate reality in many hospitals across the country. Technology is transforming hospitals, improving care, but also eliminating jobs. AI and automation now handle tasks once done by entire departments, billing, scheduling, even transcribing notes. These tools boost efficiency, but they also make many administrative roles redundant. Hospitals invest heavily in new tech, justifying the cost by cutting payroll. For workers, a new software rollout can mean layoffs, not just better tools. Even clinical roles are changing. Telehealth and automated systems reduce the need for support staff. As technology spreads, the pressure to restructure and automate grows, creating constant uncertainty for employees. The future: fewer people, more machines, and a workforce in flux. When hospitals cut staff, the first to go are usually back-office workers: coders, billers, schedulers, and clerks. These roles are seen as expendable, especially as AI and automation take over routine tasks. Hospitals can centralize or outsource these functions, saving money without directly affecting patient care, at least in theory. But back-office staff are the glue that keeps hospitals running smoothly. Their sudden absence can create chaos, lost records, delayed payments, and administrative bottlenecks. Many of these workers have years of experience and deep institutional knowledge that software can't replace. For them, being labeled non-essential is both financially and emotionally devastating. The loss isn't just numbers, it's a blow to the hospital's heart and memory. Layoffs ripple far beyond those who lose their jobs. The impact extends into every corner of the hospital, affecting not just the individuals directly impacted, but the entire ecosystem of care. They affect everyone in the hospital, from doctors and nurses to administrative staff, and most importantly, the patients. The consequences can be profound and far-reaching. Surviving staff face anxiety, a constant undercurrent of worry about their own job security. Heavier workloads, as they're forced to absorb the responsibilities of their former colleagues, and the constant fear of being next, a persistent cloud hanging over their heads, impacting their focus and morale. When support roles are cut, the backbone of the hospital's operational efficiency is weakened. Nurses and doctors pick up extra duties, tasks that pull them away from their primary focus, patient care. Taking time away from patient care, which is the very essence of their calling and the hospital's mission. This increases the risk of errors, mistakes that can have serious consequences for patient safety. Longer wait times, as fewer staff struggle to manage the same volume of patients. And a decline in patient experience, leaving patients feeling neglected and undervalued during their time of need. Administrative mistakes, like billing errors, become more frequent due to overworked staff and compromised systems. Can haunt patients long after they leave the hospital, adding financial strain to their already difficult recovery. Families of laid-off workers are also deeply affected, face sudden financial and emotional stress, struggling to make ends meet and cope with the uncertainty. Those left behind bring home exhaustion and burnout, the weight of their increased responsibilities taking a toll. Straining relationships and mental health, as they struggle to balance work and family life under immense pressure. The post-pandemic burnout crisis in healthcare is only getting worse, exacerbated by the added stress of layoffs and understaffing. The true cost of layoffs is measured in morale, the spirit and dedication of healthcare workers, safety, the protocols and procedures designed to protect patients and staff alike, and the well-being of entire communities, the health and vitality of the people who rely on these institutions for care. For those who keep their jobs, the hospital becomes a place of stagnation and shrinking opportunity. Promotions and raises are frozen, and bonuses disappear. Career ladders collapse, leaving employees feeling stuck and unmotivated. Many disengage, doing just enough to get by, a quiet drain on morale and quality. Professional development budgets are slashed, making it harder to keep up with new skills and best practices. This puts both staff and the hospital at risk of falling behind in a rapidly changing field. The most talented employees quietly look for better opportunities elsewhere, accelerating the institution's decline. The result? A slow bleed of experience and commitment, weakening the hospital from within. For those laid off, the path forward is tough but not hopeless. Start by understanding your severance package and benefits. Get advice if you can. Update your resume and LinkedIn highlighting skills in technology and process improvement. Network actively connections often lead to new opportunities. Explore adjacent fields: insurance, telehealth, public health, or healthcare tech. Use resources like unemployment offices, professional associations, and online courses to build new skills. This transition can be a chance to rethink your career and pivot to something new. The story doesn't end in New York. Hospital restructuring is a nationwide trend. Next, we turn to Orlando Health in Florida, where similar pressures are driving workforce cuts and transformation. We'll explore how regional dynamics and state policies shape these decisions and hear from those affected on the ground. By comparing Orlando and New York Presbyterian, we'll see the varied ways hospitals are adapting to this new reality. The landscape is shifting everywhere, and understanding these changes is crucial for everyone who depends on healthcare. The era of guaranteed job security in healthcare is over. Layoffs, budget cuts, and automation are here to stay, demanding a new mindset from workers and families alike. Continuous learning and networking are now essential for survival in this evolving field. Families must plan for uncertainty, financially and emotionally. The drive for efficiency and technology will only accelerate. The key is to anticipate change, adapt, and build resilience. With preparation and flexibility, healthcare workers can face the future with confidence, not fear. Thank you for watching. If you found this video helpful, please subscribe, like, and share to support the channel.